Moffitt Cancer Center is a world-renowned healthcare facility. Fortunate to have Moffitt here in Tampa. And did you know they reached a monumental milestone? Here to tell us about it, Dr. Fred Locke, Chair of Department of Blood and Marrow Transplant and Cellular Immunotherapy. So great to see you, Doctor. Thanks for being here.
Thanks, Roxanne. Really excited to be here.
Fantastic. We want to hear about this milestone and really what does it mean for patients and for Moffitt itself?
We're really grateful to be celebrating our 10,000th hematopoietic stem cell transplant, also called blood or bone marrow stem cell transplant. These are cancer treatments for patients, and 10,000 is not just a number. Really, that's 10,000 lives touched, and each transplant is a patient's journey of hope and struggle to get through their cancer journey. So we're so fortunate to be here to serve our patients.
I'm glad you explained what hematopoietic meant. I was like, oh boy, this interview is going to be a lot for me, but I'm glad I don't know what that means. You know, you have patients coming in and they're dealing with these cancers. But so I do want to focus on really with the bone marrow department, the kind of care you offer, how it's innovative in terms of patient care and the treatments and really the vision of the department.
Well, we're one of the largest stem cell transplant programs in the country. We do over 400 stem cell transplants every year right here in Tampa. Not only are we the largest in Florida, we're the largest in the Southeast. And we really have an integrated program and that streamlines the care of patients, it reduces wait times, and it really ensures that the patient experience is optimal. And we're also integrating in other cellular immunotherapies into our program. These are newer treatments so that we can offer the best outcomes for our patients.
That's what I understand with Moffitt is that you have all these cutting edge types of treatments and therapies, the immunotherapies. For some of these that you mentioned, which type of cancers do they treat?
So most of the stem cell transplant treatments we offer are for patients with blood cancers, leukemia, lymphoma, multiple myeloma. We're also offering these newer cellular immunotherapy treatments to patients with solid tumors, treatments for diagnoses like malignant melanoma. Patients with lung cancer and sarcoma are also getting treated with these therapies. And we really have integrated the transplant and cellular immunotherapy program to offer the best treatments for our patients. And the reality is that every patient has one outcome. But if we take a big picture, if we back up and look at our outcomes at Moffitt, our survival rates are better than the national benchmarks. And we really strive to provide not only optimal, seamless patient care, but the best outcomes for our patients.
What would you say to someone who finds out that they end up being diagnosed with one of these types of cancers? I mean, you see it every day. This is your department. What would you say to them to, put them at ease, give them some hope about what they're up against?
Yeah, I mean, I think the first step is to get into Moffitt and see one of our physicians and just call the toll-free number, go to moffitt.org, and it's very simple to get in to see one of our physicians. Have that conversation. The internet is not a friendly place when a cancer diagnosis occurs, so you really need to get in to see our world-class experts and really discuss the diagnosis and think through what the options are and get the best treatment for the best outcome.
And that's great advice. And we do want to give our viewers the information so you can take a look at the screen and find out more. There you go. You can visit online, moffitt.org/outcomes to find out more information. Dr. Locke, it was so great talking with you today. Thank you for your time.
Thanks so much, Roxanne.